Welcome to Charter Local Edition. I'm Tracy Young. An estimated 178,000 American women are diagnosed with breast cancer every year. But joining us to talk about legislation that she sponsored and the governor signed to ensure that California's mammography machines are operating within state standards is Senator Jenny Oropeza, who represents the 28th District and who serves as Majority Caucus Leader. Nice to have you with us, Senator.
It's great to be here. Thanks.
Thank you for talking about this. It's always sort of a difficult situation to get into, but whenever I look at the numbers that come out about the number of women that are diagnosed with breast cancer, I guess it just really makes me very sad that we haven't figured out a way to stop this cancer yet.
There ought to be a cure.
There ought to be a cure.
There ought to be a cure. And in the meantime, there ought to be earlier diagnosis, because that's how we save lives.
Tell me for a moment about why it is so important that women are diagnosed early, and then let's get into this issue of the mammography machines, if you don't mind.
Well, you know, early diagnosis, they say, is the key to survival, and not a cure, but a high survival rate. And you know, my personal feeling is that we need to encourage breast self-exam, notwithstanding what you may be hearing in the news.
Okay.
And I have personal experience about that in my family. And
I have a dear friend who also diagnosed herself, by the way.
That's right, that's right.
Very early on.
Very early in life. Right. You know, my niece was only in her 30s. And so they say you don't need a mammogram until, well, they're saying now 50. I still believe that we ought to have women work with their doctors and do what's right for them, but I would recommend 40, frankly, the way it is now, unless you're high risk, and then it's earlier.
Last number I read that was about, if you are diagnosed early, is that the survival rate over the 5-year period is about 95%. So like you're saying, it's not 100% a cure, but the bottom line is a 95% survival rate is extraordinarily high.
It is, it is. It's all, and the key is getting it in the early stage.
So speak for a moment. You know, recently we saw this study come out that said rather than us having our first mammogram at 40, maybe we should wait until 50 to have that first mammogram, and maybe even go every other year. How do we balance about what is the right thing? I mean, you're not a medical professional,
right.
I know that, but somebody who's been around this, what are your thoughts?
Well, you know, I do have some experience, family experience, and we've done a lot of work in the area of cancer and mammography, frankly. This is not the first bill I've done on mammography. And my feeling is that the most important thing is that women work with their doctors and make whatever decision is right for them, given their health dynamic. And obviously women who have the gene are going to get tested much earlier.
So it's not about age, it's a matter of the relationship with the doctor and the matter of basically your history and your genetics.
That's right. Although I think earlier is better. The American Cancer Society thinks earlier is better. I kind of think they know what they're talking about too.
Well,
so
that's why they're
there's a
called the American
controversy.
Cancer Society?
Pardon me?
That's why they're called the American
That's
Cancer
right.
Society? All right. So speak for a moment about your legislation. If somebody goes in and they're going through these mammography machines and they're testing them to ensure they're up to state standards, what is the current law about posting whether or not those mammography machines are operating up to full efficiency?
Well, until January 1, there is no law about posting the information. That was the purpose of our bill, was to give women information about what the track record is of the clinic and the particular machines that they are making a decision to have used to do this early detection. And we felt that was very important in terms of giving the woman, each woman, the information. If somebody has been, you know, given violations, we need to let people know.
So starting January 1st, the bottom line is the posting will be visible for a patient to see.
That's right.
All right. Thank you so much for your time. Congratulations on your bill.
Thank you.
For Charter Local Edition, I'm Tracy Young. Now back to CNN, HLN.
Hello, I'm Congressman Adam Schiff with our kids Alexa and Elijah. As the flu season sets in, the CDC recommends simple steps to keep our communities healthy.
Cough or sneeze into your sleeve or tissue.
Achoo! If you're sick, stay home.
And as soon as they're available, get both the H1N1 and seasonal flu vaccines.
Vaccination is safe and effective.
To learn where to get vaccinated, please visit flu.gov.